Hello, my name is Talisha Archambault and I am your health education specialist. This video is the second module in our infection control series. Module 2 will discuss and demonstrate the use of standard precautions, personal protective equipment, and hand hygiene. Standard precautions are the first level in the infection control system from the Centers for Disease Control and Prevention. Standard precautions are the treatment of body fluids, mucous membranes, and open areas on the skin as though they are contaminated. Body fluids include wound drainage, urine, saliva, blood, sputum, feces, tears, vomit, semen, and vaginal secretions. This set of infection prevention rules is required to care for every resident every time. These are the guidelines of standard precautions. Wash your hands before you put on gloves and as soon as you remove them. Be cautious not to touch any surfaces with the used gloves. Wear gloves when providing any care where you might come into contact with body fluids, mucous membranes, or open areas on the skin. Clean any skin contaminated with body fluids or blood right away. If a resident has a contagious illness, or if blood or body fluids have the potential to splash or spray during the care you're preparing to provide, wear a disposable gown. If blood or body fluids have the potential to splash or spray toward your face during the care you're providing, wear a face shield or a mask and goggles. Be careful and wear gloves when handling any kind of sharp equipment. Never put the cap or cover back on any sharp equipment. They should immediately be placed into a puncture-proof sharps container after use. Place any contaminated supplies in a biohazard bag and dispose of them as directed in your facility's policy and procedure manual. Label and properly store the container of any bodily specimens being saved for testing. Dispose of all bodily wastes as directed in your facility's policy and procedure manual. Personal protective equipment, or PPE, are items used to protect you and our residents from coming into contact with potentially infectious material. This equipment includes gloves, face shields, goggles, masks, and gowns. These should be worn when healthcare professionals are at risk for coming into contact with potentially infectious material, such as bodily fluids and broken skin. The next clip will further detail donning and doffing personal protective equipment, or PPE. Hello, my name is Talisha Archambault, and I am your health education specialist. In this video, we're going to review donning and doffing personal protective equipment, or PPE. Donning is the process of putting on PPE, and doffing is the process of taking off PPE. These processes must be completed in a specific order to best protect you and our residents. Let's first go over the equipment we will be using. This is a disposable gown. It should cover your entire torso from your neck down to your knees and extend around to cover your back. The gown has 2 ties, one at the neck and one at the waist. Both ties must be secured for the best protection. These are 2 examples of a mask that you might use. This one is a surgical mask, and there is a flexible metal band inside this mask. This metal band will lay across the bridge of your nose, and this mask has to be stretched open to snugly fit over your nose and mouth, with the bottom band laying across the bottom of your chin. The loops will hold this mask in place when secured around each ear. This mask is an N95 respirator. Using this mask requires being tested for a proper fit to make sure you wear the correct size. As with the surgical mask, The N95 has a metal band that should lay across the bridge of your nose, and it should completely cover the nose and mouth. 2 bands of the N95 secure around the head, one above the ears and one below the ears. This is a face shield to protect your eyes. Depending on the supplies that you have available, you might use goggles or a face shield for your eye protection. The foam padding of this face shield should rest on your forehead, and then the band will secure behind your head. And finally, these are gloves. You should use the correct size for your hands to ensure the best protection. Here's an illustration from the Centers for Disease Control and Prevention, which details the proper order for donning and doffing PPE. Follow along with me as I don and doff PPE. Here you can see the application of a disposable gown. The gown should be tied both behind the neck and behind the waist. As you can see, I did not get the waist tie secured appropriately. Next, I'm putting on a mask. As you can see, I bent the metal nose piece and tucked the bottom edge under my chin to ensure a secure fit. Next is the face shield. The foam cushion rests on the forehead and the strap is secured behind the head. Gloves are applied last to make sure they remain as clean as possible when providing care. The gloves must fit over the gown sleeves for proper protection. The order for doffing PPE is the exact opposite of donning. The gloves are carefully removed first. The first glove should be gathered into the palm of the second hand before removing the second glove over the first, making sure not to touch the outside of the second glove with your ungloved hand. The face shield is then removed, the mask is then removed, and the gown is removed from the shoulder area and rolled so the dirty outside of the gown is tucked inside when finished. Be careful not to touch the outside of the gown. Hand hygiene should then immediately be performed. We're now going to discuss and demonstrate hand hygiene. Hand hygiene is the most effective way to prevent the spread of infection. This can be performed in 2 ways: by using soap and water to wash the hands, or by using an alcohol-based hand rub. Hand hygiene should be performed frequently throughout your shift, especially at the following times: after removing gloves, anytime your hands look or feel soiled, before and after caring for a resident, before and after handling a resident's meal tray or assisting a resident to eat, at the beginning and end of your shift, before and after you eat, after using the restroom, after taking out the trash, and after coughing, sneezing, or blowing your nose. Such frequent hand washing can lead to dry and cracked skin, so the regular use of hand lotion is recommended. Wearing jewelry to work is not recommended, but if you do wear a watch or ring, these should be waterproof, as they will encounter the same bacteria as your hands and therefore should be washed whenever you are washing your hands. Follow along with me as I perform hand hygiene. First, I will demonstrate the use of alcohol-based hand rub. Be sure to apply enough hand sanitizer to wet both hands and at least 2 inches above each wrist. The sanitizer must be rubbed into all surfaces of the hands until it is completely dry. Be sure to interlace your fingers and rub the gel on your fingertips to sanitize the nail area well. Do not shake your hands to dry them, and do not use a towel to dry them. You should not use alcohol-based hand rub for your hand hygiene if your hands are visibly dirty or if you are caring for someone that has C. diff. Now I will demonstrate hand washing. Turn on the water and adjust the temperature to a comfortable setting first, because you will not touch the controls during the hand washing procedure so that you do not contaminate your hands again. Do not touch your clothing to the sink, because the sink is a dirty surface and you want to keep your clothing as clean as possible. Wet your hands and 2 inches up your wrists. Apply soap to your hands. Your hands should stay lower than your elbows throughout the hand washing process. Lather the soap on all surfaces of your hands and wrists. Wash for a minimum of 20 seconds, being sure to interlace your fingers. Scratch your soapy palms to get the lather under your fingernails and wash 2 inches up your wrists. Use caution not to touch the bowl of the sink and rinse the soap from your wrists down toward your fingers. Dry your hands thoroughly with a clean paper towel and then discard them. Use a clean and dry paper towel to turn off the faucet and then discard it as well.